you mentioned, you study a lot of motion analysis, right? You said like the golf performance specialists, movement links, and all other techniques you use. Let me see the list here. I know you use dry needling, neurodynamics, manual therapy, fascial manipulation, movement links especially. So could you tell us a little bit about like all these techniques you use, and especially about the movement analysis that I think it's very interesting?
Yeah, thank you. You know, I think there's so many different fields within physical therapy, right? But in outpatient orthopedics, especially, like movement's got to be the key, right? If we don't corner the market or be the specialist in how movement works, especially in pain-related dysfunctions, and whether it be chronic pain, geriatric, older, you know, vestibular systems, but also in high-level performance, right? If we don't corner the market and actually claim our stake in that market, especially from a pain, injury, limitation standpoint, because there's a lot of trainers and personal performance trainers who can do really great things as well. So that's not knocking them at all in that regard, and chiropractors too. But from a pain, disability, limitation standpoint, if you don't analyze movement in that regard and understand how it works, I think we're losing a lot of what we are in that regard. So, you know, we don't want to be the post-surgical therapist who just bends knees back and forth for a knee replacement, although that's necessary. You know, the idea of how the whole body system works in movement, and analyzing the movement is key. And then from there, you got to ask the question of, well, what's limiting that? What's causing that imbalance? What's causing that throwing, you know, the kinematic sequence to be off? Why does it hurt, you know, when you throw or swing a golf club or do ballet or, you know, do CrossFit? So to break down that movement and to break down into components of why it's happening it's been fun because of my background. Actually, I would never, I mean, even from my clinical training, I was never trained as a sports therapist per se. I was actually trained as a chronic pain therapist, which is ironic from Australia. Even my University of Queensland program, we had two different kind of divisions in our class. We had the chronic pain manipulative therapist, and we had the sports therapist. And the sports therapist was one who covered on-field coverage, things like that. That wasn't me. I was actually trained a chronic pain therapist. So in chronic pain, you know, training, we looked at a lot of more contributing factors. And this is more Maitland-based clinical reasoning models of what's your contributing factors, what's driving it, right? So joint mobility, muscle control, neurodynamics, trigger points, fascia, all these different tissue pathologies, and then capture that into a movement assessment. So then all the years I've trained with I'm a big fan of Claire Frank with Movement Links. That's a California bias. She's been a conglomerate, a lot of different movement sciences, from Florence Kendall to Yanda to Kohlars to a lot of different people. She's assimilated a lot of different things together. Michael Shacklock with neurodynamics, Luigi Stecco, who's in Italy with fascial manipulation, dry needling with Jan Demerhalt and Myopain Seminars. That's kind of who I went training with. What I really appreciate about all the different disciplines I learned from a manual, hands-on perspective was they always went back to movement, right? So you can needle something, but reassess it. You can, by movement, how they move differently. Could they raise their arm better? Not did they just feel better, but could they bend better, right? Neurodynamics, nerve sliding dysfunctions, things like that. There no doubt relates to pain, but also the ability to have less pain, but also with better movement as well, better quality movement. So it's kind of neat to see you do a nerve glide, and all of a sudden they can raise their arm better. Not only if they had less paresthesias or radicular symptoms, but their quality of motion was better. And now they can swing a golf club better or throw a baseball better, and their kinematic sequence lined up with it. And I guess lastly, with my experience at when I started my business at the Golf Performance Center, which I'm no longer part of, but we were sponsored by Nike Golf. They had a 3D capture motion reality system. So the golf pro would look at golf swing analysis, like kinematic sequences and flip head angles and launch speeds and angles of rotation of the hands and shoulders and hip and shoulder, you know, turns and things like that. And be able to match that with what we know about the human body, get the things that we know to get better out of pain, but also get the quality of motion better movement-wise, and all of a sudden see them hit the ball farther. They're not only feeling better pain-wise, but now they're hitting the ball 5-10 yards farther without changing anything. And the golfer is astonished to see, oh, holy smokes, like I'm hitting the ball farther, I feel better, and I'm not having to work as hard.